Hi, hello everyone. Hope you all are fine at home and stay safe. Anyway, we are starting the online sections. So now I'll discuss about the anatomy of rectum. In this section, I will be discussing its features, lesions, interior of rectum, blood supply, innervation, and clinical relevance. Coming to this rectum, in this figure, you can see this area. This is the rectum. That is the distal segment of the large intestine. We know the parts of the large intestine are cecum, ascending colon, transverse colon, descending, and sigmoid colon. So this rectum extends proximally with this sigmoid colon, and distally it terminates into this anal canal. The junction here in between the rectum and anal canal, this is the anorectal junction. The junction between the sigmoid colon and the rectum, that is the rectosigmoid junction. The length of the rectum, that is 12 centimeter. The diameter at the level of this rectosigmoid junction is 4 centimeter. So rectum extends from the rectosigmoid junction to the anorectal junction. Okay, it is distinct from the large intestine or the colon with an absence of this appendices epiploidy, tinea coli, this haustra or saculations. These are absent in this rectum. Okay, then to know about the location of the rectum, we should have an idea about the bony pelvis. Okay, the parts of the pelvis. The bony pelvis, it consists of two hip bones. This is the right and left hip bones. Okay, then posteriorly there is the sacrum, then sacral vertebra, then inferior to the sacrum there you can see the coccygeal vertebra, coccyx. Okay, so posteriorly medial there is the sacrum and the coccyx. Each sides you can see these are the two hip bones. Okay, part of this hip bones are, this is the ilium, this part is the pubis, and this is the ischium. Okay, then coming to this pelvic inlet, we should know the boundaries of the pelvic inlet. This is the pelvic inlet. Okay, what is seen in the posteriorly, you can see that is with that orange color, that is the sacral promontory, the sharp margin of the sacrum, body of the sacrum. With the green color, that area, that is the margin of the ala of the sacrum, that forms the posterior margin. See the anteriorly, I already told these the body of the pubis, okay, which articulates and forms a joint here, that is the pubic symphysis. Okay, that part is the pubic symphysis. Okay, the upper part of the pubic symphysis, that you can see there is the upper border of the body that forms the pubic crust. Okay, that is in the purple color. Then in the anteriorly with that blue color, that is the pecten pubis, that is the border of the ramus of the pubis. And the red color area, that is the arcuate line, that is also the border of the ilium. So anteriorly you can see pubic crust, pecten pubis and arcuate line. Posteriorly you can see that is the sacral promontory and ala. This forms the pelvic inlet. Okay, then pelvic outlet. Okay, so this is the pelvic outlet. Here you can see in this figure, you can see the pelvic outlet. This is the inferior view of the pelvis. Okay, see this is the posterior, you can see the lower part of the coccyx. Okay, here in the anteriorly, here you can see this is the inferior margin of the pubic symphysis. Its sides you can see this is the ischial tuberosities. This is the ischiopubic ramus, okay, that forms the pubic arch. So this is the pubic arch anteriorly. Then sides, see the sides, there is a ligament there, that is that white color, which connects from the ischial tuberosity to the sacrum. This ligament is the sacrotuberous ligament that forms the lateral boundary. So this is the pelvic outlet. Okay, I need to tell the lesser pelvis. Okay, so lesser pelvis, that is between this pelvic inlet and the outlet. See the pelvic inlet, you are already seen the outlet. The part between that forms the pelvic cavity, that is the lesser pelvis or true pelvis. The part above this pelvic inlet, this region, that is the greater pelvis or false pelvis. So location of this rectum, the rectum lies in the lesser pelvis. Okay, so back to this image. In this figure, you can see this is the sagittal view of the female pelvis. Okay, this is sagittal view of the female pelvis. Okay, here this is this area, this is the rectum. Okay, here this is the lesser pelvis. Okay, this is the anterior, this is the pubic bones. Here posteriorly you can see this is the sacral vertebrae. First, second, third, fourth, fifth segments of the sacral vertebrae. Then here you can see this is the coccyx. So rectum lies in front of the S3 segment. Here this is the S3 segment. This is lies in front of the S3 segment till at the level of the tip of the coccyx. Here till at the level of the tip of the coccyx. It lies 2 to 3 centimeter in front of the tip of the coccyx, from the S3 to the tip of the coccyx. So this region, this part, this is the rectum. Here you can see this is the anal canal. Okay, this opening, this is the anal orifice here. Here anterior to the rectum you can see this is the uterus, that is the body of the uterus. This is the cervix of the uterus. Okay, here you can see this is the vagina, this is the vaginal orifice. Anterior to the uterus, this is again you can see this is the urinary bladder, this is the urethra, you can see this is the urethral orifice. Okay, so the rectum extends from the level of this S3 segment till the tip of the coccyx. Okay, then here you can see in this is the sagittal view of male pelvis. Here you can see this is the sagittal view of the male pelvis. Okay, see this is the rectum. Here you can see this is the anal canal. Okay, anterior to the rectum you can see this is the urinary bladder. See the urinary bladder. Then you can see this is the ureter. Can see ureter. Then see this one important structure. This is prostate. Then here you can see this is the seminal vesicle. Then you can see this is the urethra. This is the external urethral orifice. Can see this is the anal canal. See this is the anal canal. Okay, then this is the anal orifice. Can see this is the anal orifice. Okay, so this is the sagittal view of the male pelvis, and some structures relates to the anterior of this rectum. Okay, so location of the rectum, that is here, that is in the lesser pelvis. Okay, then here in this figure you can see the superior view of this pelvis, male and the female pelvis. Okay, here this is the parts of the large intestine. Can see this is sigmoid colon. Here you can see this is the rectum. Anterior to the rectum this is the urinary bladder. Then here you can see peritoneal folds with some structures and all. Here in case of those female pelvis, okay, this is the sigmoid colon. See this is the rectum. Anterior this is the uterus, this is the body of the uterus, this is the cervix. This anterior to the uterus, this is the urinary bladder. Okay, then coming to the curvatures of the rectum. Actually the meaning of the rectum, that is straight, but it is not straight in humans. It shows some anteroposterior and lateral curvatures. In this figure you can see this is the sagittal view. Here this is this rectum. Okay, here this is the anal canal. Okay, this is the anorectal junction. You can see the muscle there. That is the muscle that is in the brown color. That is the puborectalis muscle, which maintains an angle. That is the rectal anorectal angle of 80 degree. Here this vertebra. This is the part of the coccyx. Here posteriorly we'll get the lower three segments of the sacral vertebrae. Okay, coming to this flexures. Here you can see this is the sacral flexure. This is the sacral flexure, which lies in the concavity of this sacral vertebrae. Okay, then here in the anterior aspect, here you can see this is the perianal flexure. Okay, where the rectum bends downwards and backwards. It is bending downwards and backwards. Okay, forming a flexure, that is the perianal flexure. So anteriorly that will get the perianal flexure, posteriorly will get this sacral flexure. Then in this figure you can see both the perianal flexure and both this anteroposterior curvatures and the lateral curvatures. In the first figure you can see this is the sacral flexure and this is the perianal flexure or perineal curvature. Okay. In the second image, that is the coronal view of the rectum, that you can see the lateral curvatures. See, this is the right side, this is the left side, okay, left aspect. In the right there is upper lateral curvature. See, this is the upper lateral curvature and lower lateral curvature. So right there is upper right and upper lower lateral curvatures. In the left side there is a middle curvature, middle lateral curvatures. So the lateral curvatures are upper and lower lateral curvatures and middle lateral curvatures that you can see in the coronal view. Okay, anteroposterior curvatures you can see in the sagittal view. Anteroposterior curvatures are here. There is the sacral curvature and perineal or perianal flexion. Okay. Then coming to its relations of the rectum, there is peritoneal relations and the visceral relations. First we'll discuss about this peritoneal relations. So already discussed about this peritoneum and all. Okay, here this is the upper 1/3, this is the middle 1/3, this is the lower 1/3. The upper 1/3, in the upper 1/3, okay, in the upper 1/3, this peritoneum can see in the anterior and lateral surface of the rectum. In the middle 1/3, peritoneum can see only in the anterior aspect of the rectum. Okay. Then in the lower 1/3, it is non-peritoneal in cases of both males and females. Okay. You can see in the peritoneum in the anterior and lateral aspects of the rectum only in the upper 1/3. In the lower 1/3, it is non-peritoneal. Coming to this visceral relations. In case of the males, okay, see the anteriorly, see this is the anterior aspect, this is the posterior aspect. Anteriorly you can see the important structure. This is the urinary bladder. Here the red color area, that is the prostate. This is the seminal vesicle, this is the vas deferens. Then here you can see this is the ureter. Okay, this forms the anterior relations in case of males. Okay, then here in females, this is the sagittal view of the female pelvis. Here you can see this part is the rectum. This is the rectum. Anteriorly you can see this is the uterus body, cervix of the uterus. Then this is the vagina. This is the urinary bladder. This is the urethra, can see. Okay, this forms the anterior relations. Okay, anterior visceral relations in case of females. Okay, then one more thing. This I already told about this peritoneal relations. Okay, it covers in the anterior and lateral aspects of the upper 1/3 of the rectum. Middle 1/3 you can see in the anterior. Okay, here you can see this is peritoneum. This is the peritoneal fold. It reflects to the posterior and upper aspect of this uterus, forming a fold that is called the recto-uterine fold, and forms a pouch here, that is a depression here, that is the recto-uterine pouch of Douglas. That is the recto-uterine pouch of the Douglas. Okay, this peritoneum is reflecting towards the posterior and superior aspect of the uterus, forming a pouch that is called the recto-uterine pouch. Okay. In case of this males also, this peritoneum, here you can see this is peritoneum, it's reflected towards the posterior and upper aspect of this urinary bladder, forming, this is the recto-uterine fold of peritoneum, and this pouch here, that is called the rectovesical pouch. This comes under the peritoneal relations, this rectovesical pouch in case of this males, and the recto-uterine pouch in case of this females. Okay, that's about the peritoneal relations and visceral relations. Visceral relations, we have talked about the anterior relations. Then posterior relations. Posterior relations, in this figure you can see this is the posterior relations of the rectum. See, this is the vertebra, this is the sacrum. Here you can see this is the coccyx. In relates to the sacrum and coccyx, you can see muscles. This is the levator, coccygeus, and piriformis. Okay. Then arteries can see there is a median sacral artery will be there. Then there is a lateral sacral artery. See the lateral sacral arteries. Then one important structure, this is the sympathetic trunk. Can see sympathetic trunk. Okay. These forms the posterior relations. Okay, the posterior relations are the sympathetic trunk, median sacral artery, then this one lateral sacral arteries, then this piriformis, this is the coccygeus, and this is the levator. Then here you can see this is the anococcygeal ligament is there, anococcygeal ligament. That is a fibrous raphe which extends from this coccyx, tip of the coccyx, towards the sides or the margins of this anal canal. That is the anococcygeal ligament or anococcygeal raphe. These are the relations. Okay, so these are the posterior relations. Then this is the visceral relations, and in this figure you can see the visceral anterior relations. Okay, in males, see once again the anterior relations are here. This is the rectum. Anteriorly, in case of males, this is the urinary bladder, seminal vesicle, prostate. This is the ureter. Okay, this peritoneal reflection here towards the posterior and superior aspect of the urinary bladder forms the rectovesical pouch. Okay. In case of females, here you can see this is the rectum. Anteriorly there is the uterus, body of the uterus. This is the cervix. This is the vagina. Here this is the bladder, urethra. Okay, this forms the anterior relations. Okay. Then posterior relations. This is the posterior relations of the rectum. That's all about the posterior relations of rectum. Okay. Then coming to this interior of the rectum. Okay, interior you can see is numerous mucosa folds will be there. Some are permanent, some are temporary. There are temporary folds that obviously that will disappear when it gets distended. The permanent mucosal folds are called the valves of Houston or Houston's valve, permanent mucosal folds. These are transverse folds, semilunar transverse folds. Okay, you can see here semilunar transverse folds. Okay, see the upper fold here you can see the upper fold at the level of the S3 segment. Okay, with rectosigmoid junction, and it lies some 12 centimeter above from this anal orifice. That is the upper fold. Okay, then this is the middle fold. See the middle fold. See, this is the middle fold. You can see this is the middle fold. Okay, it lies on the right wall. This is the right side, this is the left wall. Okay, so this middle fold, it projects from the right wall. It lies some 10 centimeter above this anal centimeter, average of 10 centimeter above the anal orifice. This middle fold is a constant fold, and it's important, significant constant fold. See here you can see this is the lower fold. This is the lower fold. This is the fold here. Okay, this lies some 2.5 centimeter below the middle fold. This lower fold lies some 2.5 centimeter below the middle fold. This also is constant. This middle fold is the constant folds, okay, which lies from the right wall. This upper fold and lower fold which projects from the left wall. This projects from the left wall. Okay, then sometimes there is a fourth fold will be there, that is projects from the right wall just about 2.5 centimeter from the middle fold. Okay, that is a fourth fold will be there. So in interior you can see this, the interior you can see numerous, not numerous, some mucosal folds will be there. Importantly, some 3 mucosal folds, transverse mucosal folds there. Those are called the Hosten's valve. It supports the rectum. It supports the rectum and also helps to shortens the length of rectum. Okay, that is the importance of this Hosten's valve. Then the next is the blood supply. First we'll discuss about this arterial supply. In this figure you can see this is the superior rectal artery is there. Superior rectal artery, that is the branch of this inferior mesenteric artery, continuous of the superior rectal artery. Then there is a middle rectal there, middle rectal, that is a branch from this internal iliac. Then the lower you can see this is the inferior rectal, that is a branch from this internal pudendal. So these are the main arteries supplying the rectum. Superior rectal, this is superior rectal, this is the middle rectal, and this is the inferior rectal artery. Additional to that, there is a median sacral artery will be there. Median sacral artery, that is from the abdominal aorta. Okay, median sacral. That about the arterial supply. Then the venous drainage. So here you can see the veins accompanying the arteries. Okay, here there is the superior rectal vein there. Some 6 radical veins joins to forms the superior rectal veins. Okay, which drains into the inferior mesenteric vein. See, drains into the inferior mesenteric vein. In the middle, you can see this is the middle rectal vein, which drains into the internal iliac veins. Okay, in the lower you can see this is the inferior rectal veins, which drains into the internal pudendal veins. So there is venous drainage to the superior rectal, middle rectal, and inferior rectal veins. This forms some plexus in the inner aspect of the rectum, in the mucosa, that is called the internal rectal venous plexus, and also forms some plexus outside the muscular cord, that is called the external rectal venous plexus. So that's about the venous drainage. Okay. Then lymphatic drainage. So the lymphatics from the rectum mainly drains into the pararectal lymph nodes. Okay, the upper 2/3, and the lower 1/3 directly drains into the internal iliac lymph nodes. Okay, some lymph goes into this superficial inguinal lymph nodes, mainly to the pararectal lymph nodes, that is to the inferior mesenteric nodes. Then the lower part drains into the internal iliac nodes. That's about the lymphatic drainage. Then it's nerve supply. Nerve supply, there is sympathetic and parasympathetic. Yes, this is sympathetic and parasympathetic. Sympathetic is from the L1 and L2. Parasympathetic is from segment S2, S3, S4. Okay, through pelvic splanchnos, Okay, actually the feeling of distension and the fullness of the rectum goes through this parasympathetic pathway, but the pain sensations pass through both the sympathetic and the parasympathetic. Okay, that about the nerve supply. Then rectal examination or the rectal digital examination is the examination of the interior of the rectum by a healthcare provider. It's okay to palpate the structures. In males can palpate, this is the prostate, mainly prostate, seminal vesicles, to know, it is a diagnostic procedure to know about the prostatic disorders or the prostatic hypertrophy in case of males. In females can palpate, this is the cervix, mainly the cervix. The posteriorly in both sexes can palpate the sacrum and this one, it's a coccyx. Okay, this procedure, this is called the rectal digital examination. Okay, that's all about this rectum. In this section we are discussed about this location, extent, location, extent, curvatures, relations, then blood supply, then the some applied aspects of the rectum. So hope you understood. Anyway, write down this, you should write answer for this question. That is, the describe rectum under the following contains extent, that is from it extends at from which level to which level, that is from the rectosigmoid junction to this anorectal junction. With the figure you should explain that. It's curvatures, okay, with the help of the figure you should explain the anteroposterior and lateral curvatures. Then Houston's valve that you can see in the interior of the rectum, okay, which are the mucosal folds, permanent transverse mucosal folds you can see in the interior. Okay, additional to that, you add about the relations. Okay, I forgot to mention here, that is the relations of the rectum, that is the visceral relations and the peritoneal relations of the rectum. Then blood supply and the applied aspects. Applied aspects you should add about this rectal digital examination, and add something about this rectal prolapse, find out that. Okay, yes. Thank you.